These signs all point towards bacterium. Without the cement, the bricks would fall apart. Hi friends, welcome back to the channel. I'm Filip, a medical doctor and PhD student here in Croatia, and on this channel you can join me on my journey through medicine and science. A common situation in medicine is that when a patient has an infection, they ask for an antibiotic, which in some cases it makes sense and is the correct decision from the physician to prescribe an antibiotic, and in other cases it doesn't really make sense. This can even lead to arguments between the patient and the physician, where both parties are convinced they're the ones who are correct. So let's take a look at an example. So the first patient, let's call him Steve, is a child with a sore throat who has a fever of 39 degrees Celsius, enlarged and painful lymph nodes on the neck, and visible white pus on his tonsils without any runny nose or cough. So really what the physician needs to do with this information is make an assessment on whether or not it's probably caused by a bacterium or a virus. These signs all point towards bacterium, so the physician orders an extra test and confirms that it is indeed a bacterium, and based on this test prescribes an antibiotic. So the prescribed antibiotic is penicillin, which Steve takes in the form of pills, which go into his digestive system and from there into the rest of his body, including his sore throat. The bacterium which causes the sore throat is not visible by eye, but it can be visible with a microscope, and this is what it looks like under a microscope. The thing which is located around the bacterium is a sort of wall which protects the bacterium from outside influences. This enables the bacterium to survive. And this wall is built out of, say, bricks which are held together by cement. Without the cement, the bricks would fall apart. The thing that penicillin can act on is only the cement. So, penicillin meets the bacterium, it destroys the cement, and the brick wall crumbles down, which results in the death of the bacterium. That's how the antibiotic works. Now let's look at another example. Let's call her Lucy, who is an adult of 35 years old, who also has a sore throat, and she has a small fever, a runny nose, there's no visible pus on her tonsils, and her lymph nodes on the neck aren't enlarged or painful. Again, the physician needs to make an assessment of how likely it is that this sore throat is caused by a bacterium versus a virus, and in this case he decides that based on these symptoms the more probable cause is a virus, so he doesn't prescribe an antibiotic. Why not? Let's look at how a virus looks like under a microscope. As you can see, it's quite different from the bacterium which we saw earlier. In fact, viruses are surrounded by a metal fence, if we want to continue this analogy, instead of a brick wall held together by cement. So even if she did get the penicillin can still reach the virus, but there's no cement there for it to destroy. So the penicillin has nothing to act against and it can't destroy the virus, because metal fences don't have cement. To give another analogy, asking for an antibiotic when you have an infection caused by a virus is like asking for a parachute when you go on a boat. It doesn't really make sense. To be completely fair, Steve and Lucy are on the opposite ends of a spectrum in which all patients with sore throats fall into. One of the roles of the physician is to make an assessment for each of these patients individually as to how likely it is that they have a sore throat caused by either a bacterium or a virus. So taking all of this information into account, a logical question which might arise is, even if antibiotics don't act against viruses, why not give them anyway, even if it's highly unlikely that it's a bacterial disease? One of the main reasons not to give antibiotics to everyone for all infections is that bacteria constantly evolve. They find new ways to fight against the antibiotics, which makes them harder and harder to kill later on. These are the same bacteria which are circulating in society. That's exactly what we're seeing in medicine today, and it's something that we all must fight against with rational use of antibiotic prescription. In truth, making this assessment of whether an infection is most likely caused by a bacterium or a virus can be quite hard, That's why it's best for a medical professional to do it and then either recommend the use of an antibiotic or not. So what are your thoughts or experiences with antibiotics? Let me know in the comments. Check out my video on why doctors smoke and don't forget to subscribe and hit the bell, and I'll see you later.